A nurse's experience with ancephaly. Ancephaly is a congenital birth defect where the newborn does not have a brain or developed brainstem. Tests for this disease can be done a few weeks into the pregnancy. On the right side of the screen is a healthy infant that developed normally throughout the gestation period. On the right side is an infant that had ancephaly. As you can see, the brain did not develop at all. "He looked like a normal baby," she said, "but there was a space where the brain was supposed to be. He could cry and open his eyes, but that were the only normal action he could perform." The nurses felt that the mom being admitted with the baby under this condition should have been explained to them. They were unsure of how to deal with the mom, family, and baby. They were left in the dark about the situation, and nothing was explained before the delivery. The management of the hospital did not prepare the nurses for such a difficult postpartum situation. Some nurses refused to take care of the baby. They did not want the responsibility. The neonate should have been in the NICU and not the postpartum department, but there was no way to improve the baby's health. The staff wasn't cohesive, she said. It was fragmented. No one knew the best way to treat the patient. Should congratulations be given because of the birth, or condolences because it was a matter of time before the baby would pass away? This was also a difficult situation because the family allowed the 5-year-old sibling to meet the infant and be present in the room. No one knew what to tell him. Could such a young child comprehend their day-old baby brother was going to pass away? The mother knew the baby was going to be born without a brain, but decided to deliver to term. Even though the mother had time to prepare herself for the emotional toll during her pregnancy, the unknown was still present. There was no guide on how to feel or act until the baby was born. The decision of the mother brings up the issue of pro-life and pro-choice. Should the mother have kept the baby knowing it had a congenital anomaly because she wanted to spend as much time with it as possible, or should she have terminated the pregnancy because the baby would not survive long outside the womb? The doctors left all the choices up to the family. Basically, they could decide on how to comfort the baby best. Even though the family knew what was going to happen to the baby physically, when the breathing got erratic, they came to the nurse's station asking for help. She had to tell the family they couldn't intervene. All they could do was comfort and hold him. The surrounding nurses and families were concerned for them, but she couldn't say anything because of HIPAA and confidentiality laws. She had to intentionally make the family feel like they weren't singled out. This family came out of their room crying while others were celebrating births in neighboring rooms. Other people couldn't know what was going on. The maternity ward was supposed to be of celebration and happy feelings, but on that day, this was not the case. This was the third occurrence of ancephaly during her 25-year nursing career. In her experience in nursing, it did not prepare her for such a difficult patient. She felt she could only do her best as a nurse to treat and console the family to her best ability.